Hello, it's Dr. Zoe coming to you with our next YouTube post. Let's talk about acne. Have you ever had acne? About 95% of Americans have had acne at some point during their life. It may interest you to know that acne is a cradle-to-grave disease. What does that mean? That means that there are people born with acne. Children come out of the womb, they have acne because they're influenced by their mother's hormones, specifically estrogen. Usually though, as the estrogens disappear from the baby's body, the acne disappears as well. Next, around puberty, oil glands begin to turn on again. And you guessed it, it's also due to the presence of hormones. Whether it's testosterone in a boy or estrogen in a woman, both of those hormones turn on the oil glands. Those glands are known as sebaceous glands, and those sebaceous glands produce oil. So you may ask, how in the world could oil produce acne? Well, it does, because without oil or sebum on your skin surface, you cannot have acne. What happens? Well, let's talk about it for a minute. The first thing that happens is the oil is produced on the skin surface, and on top of your skin and in your pores is a bacteria. This bacteria that is located deep in the pores is known as Propionibacterium acnes. Actually, that's where the name of the condition acne came from. So when the bacteria is deep in your pore, it needs to have something to eat. What does it eat? You guessed it, it eats your oil. So by eating sebum, the Propionibacterium acnes bacteria release a substance known as a free fatty acid. This is what's left over in your oil after the bacteria has eaten everything it needs to survive and to reproduce. Those free fatty acids that are left behind are very, very irritating to the skin. That's what causes the redness, the pain, the pus, the swelling, everything that you associate with an acne lesion. So what's the best way to get rid of acne? Well, theoretically, it would be to reduce the amount of oil on your face. And of course, cleansing is the best way to do that. Cleansing in the morning when you wake up, cleansing in the afternoon after you get home from work or school, and cleansing in the evening before you go to bed. It is that sebum on your face that drives the reproduction of the bacteria that causes acne. Now, there are other things that you can do to promote acne on your face as well. For example, ever eat a really great greasy piece of pepperoni pizza? Well, pepperoni pizza grease can also cause acne on your face. A variety of cosmetics can as well. So if you have trouble with acne, look for products that are non-comedogenic and non-acnegenic. Non-comedogenic means that they don't cause blackheads and whiteheads. Non-acnegenic means that it doesn't cause zits. Those are the red bumps and the pus bumps that we call papules and pustules that also are a part of acne. As you get older, you can still have acne, especially around menopause when hormones change again, especially in women. And as you get older, you can get a form of acne known as rosacea, where not only does the skin have the red bumps and the pus bumps, but it also has an overall red appearance, especially on the cheeks. Do you have acne? If so, you might be interested in some of the work we're doing. Give the office a call at 336-841-1411. Again, that number, 336-841-1411. Dr. Zoe would love to hear from you. Hope you've enjoyed this YouTube post.